Welcome to my YouTube channel. This is Wellness and Academics Beyond Boundaries, and my name is Femisizo Okon. My duty here is very simple to ensure that you live healthy and to bring healthy content to your notice. Then today, I shall be discussing on ulcer. We will go deeper today, so please take a glass of water as we begin. We also talk about the role of water in the management of ulcer. We also talk about the role played by magnesium supplement in the treatment of ulcer. So what is ulcer? In a very layman language, ulcer means sore, wound, open wound that is caused when there is a breach in the protective barrier of a cell. It can happen on the skin, in the mouth. If it happens in the stomach and duodenum, that is when it is called gastric ulcer. It's very simple. So what are the causes of ulcer? One, H. pylori. This accounts for about 70 to 90% of all ulcer cases. Non-steroidal, prolonged intake of non-steroidal anti-inflammatory drugs like diclofenac, ibuprofen, and the rest. Third one is stress. This is very important. Now, how does H. pylori, the bacteria, causes ulcer? When the mucosal lining is very thin, that's when the person doesn't drink enough water, and that makes the mucosal lining to be very thin. It makes it easy for the H. pylori to penetrate, to break, and then bring in the hydrochloric acid. Remember, there is hydrochloric acid in the stomach. In fact, the concentration, the pH of hydrochloric acid in the stomach is about 1.5 to 3. It is very acidic, corrosive. Now, in fact, the molarity is about 0.5 to 1.5. It is strong. So, it is the acid that will attack the cells, and that is when the person will feel sharp pains here, depending on where there is a breakage of mucosa. If it happens in the stomach, the pain will be sharp, it will be very sharp. If it happens in the duodenum, or even here in the esophagus, because of the corrosive nature of the acid. So now, what someone I think in 2 years ago, a certain boy of about 16 years walked into the pharmacy and asked me, "Pharmacist, please, I want to know. My mother has ulcer, and we are told that H. pylori, Helicobacter pylori, is the cause of this ulcer. But we are also told in secondary school," he asked me, "that there is HCl, about the pH is 1.5 to 3, according to him. I don't know how he got to know this. Maybe he was taught in school that this acid is very corrosive. Then how come that H. pylori, the bacteria, is not being destroyed by the acid?" The young boy asked a very nice question, and I sat him down. This is the answer. Helicobacter pylori has an enzyme called urease. This enzyme is able to degrade, to break down urea to produce carbon 4 oxide and ammonia. The carbon 4 oxide produced will now react with water to form bicarbonate, hydrogen carbonate. Now, 2 moles of ammonia is produced. Ammonia is an alkaline gas, but carbonate has the ability to buffer the effect of the hydrochloric acid, and that makes the H. pylori to strive even in the presence of acid. Have you noticed that some patients that have ulcer, usually some of them have indigestion? They come up with indigestion. The reason we call it dyspepsia, the reason is because the buffer system produced by this H. pylori. So when the pH of the acid is pushed forward, making it a bit alkaline, it has lost its 100% ability to to partake in digestion, because all the food particles that we eat, HCl in the stomach aids digestion. So this is why a patient that has ulcer may also have indigestion because of the buffer system produced by the H. pylori. So another thing that causes ulcer is stress. I had an ulcer and it was caused by stress because I overworked myself. Then the one that is caused by NZ, prolonged intake of NZ, can still be treated if the patient stop taking the NZ and then a proton pump inhibitor is given to prevent hydrogen ions from meeting with the chloride to form hydrochloric acid. That happens, the patient, and with proper diet, the patient ulcer will heal. The ulcer there that I mean, the sore that I mentioned will heal over time. But the one that is caused by H. pylori, Helicobacter pylori, I said it accounts for about 70 to 90%. You will require an antibiotics to first eradicate the H. pylori. If you don't remove the H. pylori, the ulcer will still be there. So now, let's consider now the importance of taking water, drinking water in the management of ulcer. This is where I come in. The mucosal lining of the GIT is composed of about 70 to 90% of water. So when you drink enough water, you certainly will have a good mucosa formed to the best size. And if it composed of about 70 to 90% of water, then don't you think that drinking enough water is good for you? The human body loses about 2.5 to 3 liters of water every day. This is a combination. It loses about 2.5 to 3 liters of water every day from the kidney, through the urine, from the lungs, from the colon, and even from the skin. So, how do you think, or where do you think the body gets this water back to replenish the lost ones? This is why you should drink about, it is recommended that you should drink about 2 liters of water every day so that the body can have the water back. And when you drink water and also eat fruit. Now, if you don't drink enough water, you will be dehydrated. The mucosal lining will be thin. It will affect even your skin will look old. It will affect your cognitive abilities. Sometimes the headache you have, some headache that you have, doesn't need paracetamol. Just it means that you are not taking enough water for that day. It could be stress, it could be hypertension, it could be dehydration that can cause the headache and other factors. Not not necessarily a very difficult condition, maybe malaria or something. It is because you need rest and good water to drink. These two can serve as magic. So when you drink the water, it will get into the cell, will be absorbed, taken to different part of the cell. Then the mucosa will be properly formed to the shape. Now let's consider the importance of magnesium supplement. I mentioned something about the place of magnesium supplement in the management of ulcer. Magnesium plays an important role in water uptake. You can drink water and the cells may refuse to pick it to take them and use. The cells may refuse, they may not enter into the cell. So what do we do? Magnesium is very, very important. It helps the cell it helps water to go into the cells. Magnesium interacts with aquaporins, which is a protein, a water channel in our cell membrane. So magnesium serves as a cofactor in many enzymatic processes. So in the case of water, is that an exception? Magnesium is very important. I don't want to go deeper because or to go into something else like being able to relax our smooth muscles and the rest is good in the management of hypertension. So, what do you do? Once you are dehydrated and you know that you are dehydrated, how do you know that you're dehydrated? The volume of urine produced that day will be very little. The amount of urine produced that day will be very, very little. Amount of urine produced that day will be very little and concentrated. Now it will be more darker that day because it is concentrated. What do I mean by concentrated? There is an increased amount of dissolved solute in the urine as compared to the little amount of the urine formed, and that's chemistry, don't mind me. So once for my people, they will think they have malaria. It is not malaria, it's only that you have not taken enough water for that day. So what you should do is get a glass of water and take it in bits. Sip them, take, take them in bits, and then the body will be able to absorb. But in a situation where the body cannot absorb water, what do you do? Get magnesium supplement. There's one salt called Celtic salt. It's obtained from freshwater salt. Just place it on your tongue. Drink the water. It helps work like magic. If you cannot find Celtic salt, because me, I've not seen it before, but I know it's available in supermarket. If you cannot find Celtic salt has, apart from sodium chloride, it also has other minerals like the magnesium. Magnesium, like I said, is very important. It helps the cell to take water into the cell. So, drinking water will help you to build the mucosa so that you can be able to fight and defend you against the corrosive nature of the hydrochloric acid. I want to stop here, but let me recap. I told you I have mentioned the causes of ulcer, the H. pylori, prolonged use of NZ, stress. I've mentioned the usefulness of taking enough water. I said it helps to build mucosa, and once the mucosa is properly built, it protects you against the corrosive nature of the acid. So I want to stop here, and I know that you have enjoyed this content. For more exciting content like this, subscribe to this channel now. Turn on a notification button so that when I upload other healthy content, your YouTube will send you notification. Until I come your way same time or come your way next time, have a blissful day ahead. Bye bye.